Welcome to another episode of Stories from the Edge of Life. Once again, we have a very special guest, Amy Mann. Hi, Amy.
Hi, Prague. How are you?
Great, thanks. How about yourself?
I'm doing well.
Great. Amy, would you mind introducing yourself to our audience, please?
Sure. My name's Amy Mann. I just turned 50. I have a very complicated medical history. I'm a patient who had hypertrophic cardiomyopathy and went on to have a heart transplant after a very short bout with heart failure that I went downhill very fast. And I am a patient advocate. I'm a mom. I'm a dog mom too. You might see my friend Jude in the background. Yeah, and that's pretty much, I guess, what I have to say about myself.
Thank you for the introduction and thanks for introducing us to your company that you have right now. My name is Parag Bharadwaj. I'm a hospice and palliative medicine physician in the US. So, Amy, you mentioned you had a heart condition. Can you share with our audience as to when it was diagnosed and what transpired between the time of diagnosis to when you got a heart transplant?
Sure, it's kind of a long journey. I was actually diagnosed with hypertrophic cardiomyopathy at the age of 5. Hypertrophic cardiomyopathy is, we abbreviate it, we call it HCM because it's a long term, but it's actually the most common genetic heart condition there is. It's estimated that at least 1 in 500 people have it. Most people don't know they have it. It's chronically underdiagnosed and misdiagnosed. So from my point of view, I was quite lucky to get diagnosed very early on. What had happened is we knew there were heart issues in my family. My grandfather was struggling with heart failure, I think, at the time. My mom had to leave college to look after him. He was still a relatively young man in his 40s at that time. And my mom, when she was about 30, she had an incident where she was driving and she passed out. And unfortunately, I don't know, fortunately, actually, I don't know, I'm not sure. She didn't hurt anybody, she didn't hurt herself, but she was taken by ambulance, and we lived in New Haven, Connecticut at the time. And she was seen at Yale. And before she passed out, she remembered feeling like a crushing feeling on her chest. And she was found to have hypertrophic cardiomyopathy, or at that time it was called IHSS. Can't quite remember what it stands for. And Yale at the time knew that there was likely a genetic component, which is very unusual. This was back in the 70s, mid 70s. So they went on to screen me and my brother. So I was 5 and my brother was 6 at the time. And I was found to have the condition. And at the time, my brother was found not to have the condition. So we thought he's fine. It's passed down 50-50. It's caused by at least 11 mutations in at least 11 genes. We know that now, it was not known back then. So as a young person, I guess I kind of feel like I always knew I had the condition. And when I was a child, the only thing I remember how it manifested is that things like PE, I was really bad at it. I dreaded the runs, when you have to do the mile runs, I was always slower. But from, I had a pretty normal childhood medically. I just had to go for regular screenings. I do remember my mom being in heart failure from when I was about 8. So I remember wondering why she had to take potassium, and, I didn't really understand, but she had a lot of problems throughout my whole life. And when I hit puberty, things started to change. I think I was told that I could do by my team, I was told that I could do some exercising. And at kind of, I think around the age of 11, we moved from America to the UK. And, at school, I participated in basketball, and an incident happened when I was playing, and I started to feel myself passing out. So I kind of got to the sideline, and, I would call it a semi-syncopal episode, which means that I was a little bit with it, but I had to lie down, everything went black. I was, aware a little bit. And then after lying down for a while, I came back to, and that was my first hospitalization, actually. I was hospitalized, and they did a lot of testing on me, and I started on medication. Now, at the time, there was no real medical treatment for hypertrophic cardiomyopathy. There were drugs that were kind of used off label to help, like, kind of reduce the contractility of the heart. So with hypertrophic cardiomyopathy, basically you have a thickening in your heart, usually in your left ventricle. And it can vary from person to person where the thickening is. But on a cellular level, there's also a disarray of cells. So it can cause arrhythmias. It can cause syncope or fainting. It can cause shortness of breath. It can cause fainting, any array of arrhythmias, from innocent ones to deadly ones. It's the leading cause of sudden death in young people. So they did their best to kind of assess me at the time to see if that I was having any serious arrhythmias that might have caused me to pass out. I was basically told that I had to kind of slow down, and I had to kind of leave the basketball team, which was really challenging. Being a teenager, like, it was, all of a sudden I really realized I was different. So from that point onwards, I kind of went through a bit of a funk, and but I kind of pulled myself together and realized that, yes, I had some limitations, and, I was more short of breath than I had been. I had arrhythmias, but I decided just to carry on with life, because what else can you do? So I went on to college. I did all the normal things that young adults do. Sometimes, they weren't so good for me, but I just wanted to be as normal as possible. When I say not so good for me, I mean, like, when you're in college, people tend to, drink alcohol, and it's not contraindicated with this condition, but dehydration can cause more symptoms and things like that. So I went on, after college, I got married, I started a family, I moved from England back to America, and I was living in Florida. I had 2 young children. Both pregnancies went really well, and normally they do with this condition. Everyone needs to be independently assessed, because it's one of those conditions that you can have no symptoms, a whole array of symptoms, and sometimes even if you don't have symptoms, you can be at risk for sudden death. So it's a very complicated assessment. Now, when I went on to have my third child, my third pregnancy, things changed dramatically for me. So to put it into context, it was also a time that, as I had mentioned earlier, my mom had been in heart failure pretty much my whole life. She had been listed for transplant, and she had just transplanted when I became pregnant with my third child. And I noticed almost immediately early on in the pregnancy that things had changed. I was working at the time, and I suddenly became much more short of breath. I was feeling more arrhythmias and just not feeling well. So I went to my local cardiologist, who did all the normal things that you do when you have this condition. You have an EKG, you have an echo, and I remember he said to me, "This is not good." I also had a 24-hour monitoring to monitor for arrhythmias, but he said, this is not good. You have obstruction to your outflow tract. So to put that into context, when you have a thick heart, sometimes the thickening can block the outflow of the blood out of your heart. I did not have that prior to this pregnancy, but during the pregnancy, I suddenly had this. I had what's called obstructive heart hypertrophic cardiomyopathy. And in addition to that, he said I was having runs of ventricular tachycardia, which is a more dangerous arrhythmia and can lead to ventricular fibrillation, which can lead to sudden death. So he was a local cardiologist, not a specialist in HCM. And, you know, I was still quite young. I was in my late 20s, nearly 30. And I didn't believe him. I thought, but I was fine. You know, I've been fine. I've always find that it takes a while for the mind to catch up with new medical news, you know, especially when it's not good. So what I did is I called my mom, and my mom had, going back as a teenager, she had started a patient advocacy nonprofit in the UK called Cardiomyopathy UK, because she saw so many gaps in care and saw that so many patients were not getting the treatment or the screenings that they needed, knowing that it's genetic. So she started that, and she was very well connected in the world with all the specialists. So I called her. She was, you know, only probably 6 months post-transplant at that time. And I said, you know, they're saying that things aren't good. So I went to get a second opinion by a very renowned HCM specialist, thinking that he would say, you're going to be fine. And at this point, I was just, I think, about 21 to 24 weeks pregnant. I can't remember exactly by the time I saw him. And he was very stern and honest and said that this is not good, that you do have obstruction and you are having dangerous arrhythmias, and I give you 50% chance of living through this pregnancy. I could not get anybody to care for me in this pregnancy. I couldn't get an obstetrician to touch me. I called around, nobody would take me. So I went back to England under the old team I was under, because they wanted to put me on amiodarone, which is an antiarrhythmic drug, but it's also known to be a quite toxic drug. So that was not something they would do in America, but they felt that was my best chance. So I flew back to England with the goal of carrying out my pregnancy there, being seen and seeing what's going on with my heart after the pregnancy. And then I was going to return home. Unfortunately, things kind of melted down, I would say. I did start an amiodarone. Then unfortunately, when I was 7 months pregnant, I was living at home with my mom, I noticed things weren't right with her. And she developed a brain tumor as a result of the transplant drugs, a lymphoma that had gone, you know, to her brain. And she had a very quick, I guess, demise, and passed away when I was 7 months pregnant. You know, so that was really challenging. And I spent a month in the hospital prior to having my third daughter. I had 2 young kids with me as well. My husband was still back in Florida. A lot was going on. And they were just debating what to do with me, how to deliver me. Eventually, they didn't want to induce me. They didn't want to do cesarean section. There's so many, every day they changed their mind. I delivered, I think in the end, they decided to induce me. They had all the resuscitation cart there all lined up. I was monitored. I had so many people there. And fortunately, everything went very smoothly. And I was in the UK, and every woman in the UK, even if they're high risk, they have a midwife as well. And I had the most amazing midwife who was an advocate for me. And I remember the doctors wanted to pull the baby out because they didn't want to put pressure on my heart. But she, as a midwife, knew that it was just my third child, that I could do it. So she basically, as I was delivering, told them to back off. And I delivered just fine. Afterwards, about 6 months afterwards, I went on to have my first open heart surgery. They think to take away the obstruction. So they're basically cutting a little slice of my heart out. They can't take the condition away, but they can do things to improve symptoms. So they think that during the pregnancy, you have a lot of extra blood volume when you're pregnant. They think that all the extra blood volume caused a muscle cord in my heart to possibly snap, and my heart kind of bulged out and caused the obstruction. So I had a surgical myectomy, which was quite a long recovery. And then I went on to have internal defibrillator placed in my chest because I was still having the arrhythmias. So
could you explain what that is for our audience, the internal defibrillator?
Yeah, so basically, if you think of, I think most people know what an external defibrillator is. Like, it's a machine that shocks you back into rhythm if you have a cardiac arrest. So an internal defibrillator, it's the same concept, but it's actually put inside your chest. And for most people, it's put kind of on your left side, like under your collarbone. Different doctors do it differently. Mine was kind of wedged in the muscle. So it's a little box, and there's wires that go to your heart, and it detects arrhythmias. And you have it checked regularly to see what's going on, and they can make adjustments. And really, it's there to protect you in case you go into a very serious arrhythmia. It will try to get you out of the arrhythmia. And if it can't do that, it will shock your heart back into rhythm. So I hope that answers
Thank you.
the question. So I went on to have that done. And as you can imagine, that was a very stressful time in my life. And unfortunately, my marriage kind of fell apart. But after, kind of getting myself back together, going through grief, going through, the demise of marriage, going through surgery, now having 3 children. I pulled myself together once I recovered, and I went on to get a second degree in midwifery because I was so inspired by the midwife during my very high risk delivery. And I went on to work as a midwife for quite a few years in the UK, and I remarried. I felt very well after the surgery, better than I ever had. I didn't know what normal was because I was never normal, which is a very common thing for people who I think are diagnosed with a chronic illness at an early age. So I, really had a very good quality of life for a number of years. And then when I was 39 and I was remarried, I had a surprise 4th pregnancy. It was not on the cards. I say that I did have measures in place to prevent pregnancy, but it still happened. And the first person I went to is my cardiologist, and I was a little terrified. And I said, is this a good idea? I don't know, like I have 3 children to look after. And, I had a very good relationship with my cardiologist at this time. He'd been with me through so much. This is still in the UK. and he felt that I would be okay. I'd been really well since my ectomy, and I did have a few issues in the pregnancy. Um, I I would say that was the first time that I think that I had heart failure symptoms. They were transient. I developed a kind of a chronic cough in the pregnancy, and they couldn't really decide what was going on, but they did give me some diuretics in the pregnancy. They put me on a beta blocker, which is actually quite a common drug in hypertrophic cardiomyopathy. Again, off label, it's to relax the heart. Because remember, we have stiff, like hyperdynamic hearts. And I went on to have a healthy pregnancy. I did spend, I say healthy pregnancy. I was on bed rest for a lot of the pregnancy because of some of the symptoms I was having. And I am one of those people who's very sensitive to medications, and the beta blocker really lowered my blood pressure. So I had a lot of dizziness and fainting, and I wasn't able to work. So I was kind of written off work and told to take it really, really easy. And I was induced early, I think 5 weeks early. And I do think that there may have been times that my baby was a little bit compromised because my blood pressure was so low. But I did deliver just fine. She did have, my youngest daughter, who's now 10, she did suffer from failure to thrive in the beginning. There were some issues, I think, relating to my heart and the drugs I was on, but essentially, we did well. And everything after that, well, when I say everything after that was great, I did struggle afterwards with postnatal depression. And I think, if you look at the history of people who've been through a lot of medical issues, it really wasn't a surprise. And being that I was a midwife and a quite experienced one at the time, I recognized it very early on, and I sought help for it. And I was in Europe, so I had very good maternity leave. I took a whole year, and I decided I kind of hit a wall. I think everything caught up with me, and I decided that I wanted to take time off from work, and I wanted to be home until my youngest one started school. So, to make the story more complicated, my husband was able to transfer jobs back to America. So it was a British company that had American offices. So we ended up back in Connecticut. And I was seen at Yale, which is interesting because that's where I was diagnosed originally when I was 5. So I was under the care for with a hypertrophic cardiomyopathy specialist from 2013. And then about 2016, things started to change. It's very subtle at first. Prior to that, I was doing the normal things. I could keep up with everything. I exercised, I went to the gym, I looked after my kids, I was involved in a lot of things. I, became a yoga instructor, just did like things while my daughter was, not at school. And it was just about the time that she was starting school that things went a little bit south. I knew something wasn't right. I first noticed things like when I was reading her a book at night, I would get short of breath. And there were other times that randomly that I would just start to feel like I had to I couldn't stand up. I'd get dizzy. And I went to my cardiologist and they ran tests, and initially I couldn't find anything wrong or different. My echo didn't really change. They checked me for everything else, thinking it could be Lyme's disease, it could be anything. Everything came up negative. So over the course of about a year, I was back and forth. And the thing is, everyone always says you look so well. And people with chronic illness in particular know their bodies really well. You learn to know and listen to your body. And, they said maybe it's anxiety. They put me on medication for anxiety. And it wasn't anxiety. I went back and I said, this isn't changing things. Things are getting worse. And then I got a virus it was my daughter's high school graduation, my oldest daughter's high school graduation. Around that time I got a virus, and it was June that she graduated, and the cough wouldn't go away. And I kept going back and forth, and still, everyone's like, I'm not really sure what's going on. I went on a vacation in August with my family, and on the way back, I remember feeling really, really unwell. And I said to my husband, something's really wrong. And I called up a friend who runs the Hypertrophic Cardiomyopathy Association in America. My mom had mentored her and helped her set up the organization here. And I was telling her what was going on. She called my doctor because she has a lot of connections. And I'd also mentioned that I'd been putting weight on, and my ankles weren't swollen, which is very common in heart failure. But I knew I was putting on weight, and I could kind of see it in my face. And if I would press my face, I would have pitting edema on my face. It was very odd. And he rang me back, the doctor rang me back almost immediately after my friend from the association called, and over the phone, he says, "You're in heart failure." I said, "Yeah, hallelujah. Someone's finally figured out what's going on." So he wanted to bring me in the hospital and start me on diuretics. And I said, "I can't, because I have to bring my daughter to college next weekend," which is a silly thing to say, but it was really important to me. So he knew me and knew I was a former medical professional, and said, "Okay, well, let's start you on at home. We'll start you on the diuretics, so please keep in touch with me." And I started on them, and I took fluid off very, very quickly. And we have a very stiff heart that doesn't do well with, I guess, when there's a change in fluid, we don't, most hearts are stretchy, ours are stiff. So I basically, after about 4 days, I had a phone call from my friend, her name is Lisa, from the association, to tell me she was coming to visit me. She had transplanted a few years prior to that, and I would go to visit her. And she said, "I'm coming to visit you today." And she lives in New Jersey, which is a few hours away. And about 45 minutes before she arrived, something very odd started happening to me. I started to lose the feeling in my legs and my hands. I had to lie down. I called her up. I said, "Something's wrong." One of my middle daughters, who was 16 at the time, or 15, I think, was home. And I said, "You might need to call an ambulance. I'm not sure what's going on." She started crying and getting very concerned. And then Lisa showed up. She had been in touch with my doctor, and she took me straight into Yale. And that was my first hospitalization. And I think it was the first time the word transplant was said. I don't think they started the assessment at that time, but I had a very serious conversation, and I knew that it was going to be sooner rather than later. And after that, they kind of, I don't know, it's my memory from that whole period between the psychological trauma and the fact that I was decompensating is a little hazy, but I had several hospitalizations and I started to go downhill. I had a PICC line put in to have an inotropic drug, which is just to help keep your heart pumping, called milrinone. So I was kind of just getting sicker and sicker very quickly. I was quite rapidly assessed for transplant. And I was actually, because I was going downhill so fast, I was double listed at Yale and Newark Beth Israel. There was a strategy to that because the decompensation was happening so quickly. I had numerous hospital admissions, and then I was admitted to Yale to the intensive care unit, and I was told that I wasn't leaving until I got a heart. I was thinking I was going to be staying there for months. About 4 days later, there was a call from Newark and they had a heart for me. So they flew me, it was Labor Day weekend, and they flew me out by helicopter to get me there in time. So my husband actually got there first because I was hooked up to so many things. And I went straight into the room to get ready for surgery. My husband was there. Everyone was so loving, the nurses, the doctors. And I felt an overwhelming sense of peace. I went into surgery. I said goodbye to my husband. And I said, I hope I see you. And I remember the first time I woke up and I knew I was alive, and it was quite an amazing feeling. I was still intubated, and I remember that, they slowly kind of, waited till I was awake enough, and, I realized that I was alive. My initial post-transplant course was not very complicated, a few little things going on, but essentially I was discharged in 2 weeks. My first year, I had several bouts of moderate rejection, which was challenging. The medications were challenging. But since then, I've been doing fairly well. I'm now 4 years post-transplant. I've had a few hospitalizations with infections, but overall, my quality of life is amazing when things are well. And yeah.
Wow, you've been through quite a journey. And I'm glad that you got the heart transplant, which was, just so everybody knows, not everybody is lucky enough to get. So Amy, this has been fantastic. Thanks a lot for sharing your journey. What we will do is we will schedule another interview with you to talk about how you handle things on the personal front.
Yeah, there's such a long, complicated process that it's hard to sum up. It's a whole, it's not just a medical process, it's a emotional, spiritual, psychological, all those things. So
we'll see you again back soon.
All right, thank you.
Thank you very much.
All right.